Now I'm talking to Shari McDaid, the Director of Mental Health Reform. Shari, how's it going?
Very well, thank you, Darren.
We're here at the event organised by ourselves, Mental Health Reform, No Room at the Inn. We're talking about mental health services throughout the country in the Republic of Ireland. Could you give us, first of all, could you tell our listeners, mental health, who are mental health reform? The name is kind of self-explanatory, I know, but is it true you're an alliance of all different mental health organisations, are you?
Yes, that's right. We're a national coalition in Ireland, so we have 39 member organisations, and they cover organisations that run mental health services in the community, voluntary sector organisations providing things like helplines, but they also cover organizations that see mental health as important to their work. So organizations working with homeless people or working with refugees, working with people with disabilities, children's rights organizations and children's mental health organizations. So a very broad spectrum. And we also include in our membership professional associations of some of the professions that are involved in delivering mental health services.
Is that your full-time job or mental health reform?
It is indeed, yes. It's a full-time job to be the Director of Mental Health Reform.
Yeah, I was thinking that. Just if you could talk about the event tonight, starting soon, No Room at the Inn. From my understanding, my mum works as a receptionist in a mental health hospital, and from my understanding, where I live in Dublin, in Castleknock in Dublin 15, from my understanding, is a service for inpatients is okay from what my limited understanding, but maybe you can correct me on that. But it's true that the situation is there are big differences in different areas. Is that true? Yeah.
It's very true that the services have developed differently around the country, and that both the kind of service that's delivered in different locations and the number of staff that are available is different in different parts of the country. So we can have a situation where a service on one side of the road is very good quality, and a service on another side of the road might be much more challenging, or one that isn't able to provide the full range of supports.
And just so it's very important to know, I think, could you give, without going through every county in the country, could you give a quick summary of who's doing well and who is the opposite of that, not doing well at all?
Well, we do know that there are pockets of innovation where particular leaders in that service have really tried to drive change. Way back in the 1980s and 90s, the services in Clondalkin developed home treatment services so that they would try to help people who are in crisis in their home rather than having to admit them to hospital. And similarly in Cavan Monaghan, they developed a very intensive home treatment and community-based service back in the 90s. And since then, there are some other services that have really pushed a fairly progressive agenda, services like the one in West Cork, where they've tried to drive a very recovery-orientated service, the service in Loughrea, in East Galway, the service in Selbridge, which Dr. Pat Gibbons is going to speak about tonight, is also trying to drive a home treatment service, one that would help to minimize the extent to which people have to go into hospital. And so they're really leaders across the country in terms of the type of service delivery that they're put together.
And when we talk about the name of tonight's meeting, No Room at the Inn, are we talking about no room at the inn for inpatients and mental health hospitals, or outpatients, or both? And could you tell us what areas in particular we have the problems in?
We chose the phrase "no room at the inn" as a way of describing, in a way, the feeling that people have when they're trying to access support in a crisis, when they're feeling quite unwell, anxious, perhaps experiencing suicidal thoughts, and when they're trying to seek support and finding it challenging to get the support that they need. So it may be that they're going to A&E and they've described to us that that's not a very easy way to try and get support. It may be that as a family member that they found in the past that they didn't know where to go to find help. So those are the reason that we chose No Room at the Inn. It was really to describe that sense of not knowing where to go to get timely access to support when one is feeling quite unwell.
And the solution to all this, people's problems in society, is really education, isn't it?
I think that there's a whole wide complex of solutions that are needed in order to really fulfill the vision of mental health support that we want to see in the future, one where everyone can recover and live a full life in the community. And that complex includes people being more welcoming and more open to people who have a mental health difficulty and open to supporting their recovery, everything from employers and neighbors and local shopkeepers and family members being involved together. And it also means providing enough resources in the mental health services that they can provide the full range of treatments that people want, so that they can have the time to be listened to and to work through their crisis in a partnership way.
And just to talk, it's true that in the last 10, 20 years, throughout history, it's been getting better, but the prognosis for people with mental health issues has really improved hugely in the last 20 years. The biggest mental health illnesses in financial terms of cost and numbers and stuff, we what's some kind of bipolar and schizophrenia and these things. But the medication and other ways of approaching these problems have improved hugely, haven't they, in the last 20 years?
I think there's a lot more hope now than there used to be. I think that people themselves are developing a better understanding of how to look after their own mental health and how to draw on the professional supports that are there at the right moments and make best use of them. So, and as well, I think family members are becoming more comfortable with the idea of supporting their relative through a life of learning to live with a mental health issue that you have to manage over time. So, I think there's lots of reason to be hopeful, and we really have more and more evidence about how people recover from a mental health difficulty.
That's great. And this last question, I know you have to, the meeting's starting soon, you have to go. Just to finish up, today in January 2014, we have a vision for change and all this stuff, but there's also cuts in the health service. How is the mental health services doing in an overall picture in terms of finance, in terms of a vision for change and for the next few years? In what direction are we going? Are we going in a good direction, you think?
Well, I think that the current Minister Lynch, has advocated very strongly for mental health to get increased resources. We still have yet to see those resources really fully delivered. That means we still are about 1,000 people down on the staff that we were even in 2009, and we're well below what the government's mental health policy would recommend for the staffing for the mental health services. So we do need to see that momentum sustained, but we're starting to see progress in terms of more staff in community mental health teams, and now that we have a national director for mental health, we're encouraged that there's someone at the top that can really drive the reform across the whole country.
Okay, that's great. Shari, I'll be talking to you again at some stage, I hope, right? Thanks very much.
Thank you, Darren. Good luck.
And now I'm talking to Anne Foley. How's it going, Anne?
Not too bad, Darren, and yourself?
Grand, thanks. We're here at the event, No Room at the Inn. You're involved in the mental health sector. Could you give us an introduction, please, of what you do or your involvement?
Yeah, firstly, I'm a service user. I'm also chairperson of the Wexford-Waterford branch of the consumer panels. Consumer panels were set up in a vision for change to help with service providers in telling them what was working in the system, what's not working in the system. And our role is advisory, and on our panel we have family members, we have service users, family members, carers and service providers such as psychologists, nurse managers, social workers, and we're all working together to make a better service.
And how is the service in your area like?
Service is pretty good overall, in that, like everywhere, the cuts have hit us. Our staff are Our staff in our day centre hospitals are working to capacity. They, at the moment, there's a restriction on our moratorium on employing staff, and unless that's lifted, service in the community is going to go down. Like, I mean, at the moment, you know, Vision for Change said that all mental health teams should have each of psychiatrists, psychologists, nurse manager, nurses, OT, social worker, you know, the whole rigmarole on the team, and we're looking in Wexford-Waterford we have. But in saying that, we have also been told that some of our nurses may have to go back into working in the hospital, which means that the services in the towns in Wexford and Escorthy and in New Ross and Gorey, that some of the staff from the day centres will be taken away.
Mm-hmm. And are there these committees like all over the country? Because I've never heard them before. Like.
Yeah, they are. We were officially part of NSU. NSU is gone now because they've lost faith.
What is NSU?
Yeah, NSU started setting, were the people who first set up consumer panels, but they themselves, the HSE lost faith in them. And now consumer panels are out on their own. We're trying to bridge the gap between provider and user, and consumer panels are here to stay. They're set up all over. There's 2 in Cork, there's a couple in Dublin, there's some up the northwest, there's some in Mayo, there's some in Kilkenny, Carlow. They're springing up all over the place, and we eventually, some of our members will end up on the management teams in the hospital sectors, helping to advise the staff what's working in the service, what's not working, what the service users are saying, what we're saying. Personally, as a service user, I'm on the panel now for 2 years, and we have brought up stuff, and we have seen changes in the local area, in Waterford. In Waterford Regional, they have improved the service an awful lot, but it could be improved further, because Waterford itself doesn't really have any community mental health teams as such.
And how long are these committees on the go again?
Well, Waterford, Wexford is 2 years. Kilkenny and Carlow is a bit longer than that, as far as I know. And Cork is the same. A lot of them have sprung up in the last, I'd say, 5 years since Vision for Change came in.
Yeah, that's great. I don't think they're in the local one, my local one, Dublin 15, but hopefully they will be, you know.
They should be, yeah. There's a few in Dublin.
It could be. I don't think they are in my Dublin.
Yeah, maybe not in your area, but there are a few in Dublin. Unfortunately, I'm not the main person that would have the contact details, but there are people out there who I can put you in touch with who would know where they are.
Okay, thanks very much. I'll be talking again. I hope it's a good meeting.
Thank you very much, Darren. Thank you. Pleasure.
Change,